Thank you so much for joining us for our third session in this year-long series of learning that we are hosting. My name is Danya Keene, and I manage advocacy and education with the Partnership for Strong Communities. The partnership is so excited to host this series where we have prepared a wide range of conversations with advocates and leaders in other sectors to talk about the impact that a lack of safe, affordable housing has on the work that they do. Before I get into more information about the partnership and today's topic, I just want to remind you that this series is taking place on the first Wednesday of every month. It started in February and it will run through October of this year. If you're sad and wondering why there's not a session planned for November, don't be, because that is when we host our Affordable Housing Conference. It will be virtual this year. It's going to be November 18th and 19th. We really hope to see you there. But it's an expansion of the conversations we're having here today and with other affordable housing advocates and partners across the state and country. So we really hope to see you there as well. Some quick housekeeping before we dive into today's conversation. The session is being recorded and will be published to our YouTube channel under the Intersectional Webinar Series playlist. Usually within the week, it's up on the site, so please be sure to check that out, share it with folks who maybe weren't able to attend today. And if you have any questions, please use the chat box at the bottom right-hand side of your screen to add to the conversation, jump in with questions in the chat when they come up. There will be time at the end. We'll try and get to as many questions as possible in the time we have allotted, but we're excited to engage in this conversation. So with that, let me first introduce you to the partnership and why we're hosting this series. So we're now in our 26th year, but the partnership works to promote equitable change in Connecticut housing policy by coordinating advocacy, advancing research, and uniting diverse partners. Our vision is that everyone in Connecticut has a safe, stable home that is affordable to them in an equitable community of their choice. And our mission is carried out through partnerships. We are committed to policies and practices that reduce disparities in housing and within our organization. We ground our works in fact and data, and we prioritize housing solutions that will be affordable and sustainable in the long term. So at the partnership, we work to actively create and support an anti-racist, inclusive culture throughout all of our work, internally and externally. And like I said before, are committed to addressing policies and practices that have perpetuated disparities in housing, and again, within our organization. And we really believe and operate under the lens that housing is a human right. We ground our work in honest, factual, data-driven information that we use to dispel myths, challenge stereotypes, and fill gaps in knowledge to drive narrative, policy, and systems change. And we prioritize housing solutions that will be affordable and sustainable long-term. We focus on the full spectrum of housing need and experience of communities now and for generations to come. So how do we realize or actualize our vision? We know that a healthy housing system necessitates a comprehensive approach that intertwines housing affordability, creation, choice, and stability. People need to be able to afford their homes while meeting their other basic needs. We need more physical homes, period. We need all different types of homes for people to choose from in all communities across our state. And people should have the right to safe, stable homes and be supported from the experiences of housing instability, eviction, and homelessness. This is how we weave a housing system that prioritizes the needs of our residents and that supports strong families and strong communities. And to orient ourselves to today's conversation, we'll predominantly be focusing around the priority of housing stability. So this word cloud that you see was generated from our Affordable Housing Conference last year in 2023, where we asked attendees to share the words or phrases that describe what a thriving community looks like to them. What you see here is a culmination of about 81 different responses. And really what it shows us is that a thriving community is inherently intersectional. Intersectionality is a framework for conceptualizing a person, group of people, or social problem as affected by a number of influences. It takes into account people's overlapping identities and experiences in order to understand the complexity of the experiences that they face. When we think about building thriving communities, we need to think beyond just the lack of available housing options. We need to think about the accessibility of food, clean water, healthcare, green, sometimes known as third spaces, school systems, services, diversity, everything under the sun. Nothing exists in a vacuum, especially not housing. And that's really why we're hosting this series. I do think it's important for us to take a moment to acknowledge that while we're talking and thinking about the intersectionality of the conversation around housing, we need to also acknowledge its inextricable link to the land that we both live and build on. While there is a lot of work for us to do regarding addressing our history and the impact that it has left on many families, this is one place that you can start by learning a little bit more. This link on the side, nativeland.ca, is a really great resource for introducing yourself to the Native populations and tribes in your communities and across the state and across the country at large. So it's a great place to start learning some more, but it is something that we should be mindful of and continue to build our knowledge and hold ourselves accountable to. So now that you know why we're here and who we are, it's my pleasure to introduce you to this really wonderful panel put together by Health Equity Solutions, but brought together also with the Yale School of Public Health. Today, we're really going to hone in on how safe, affordable housing links to health equity and how addressing those disparities improve our health outcomes. So with that, I am very excited to pass it over to Namandje to introduce Health Equity Solutions and kick off the conversation from there. Thank you so much for joining us.
Awesome, awesome, awesome. Well, thank you all for being with us this morning. I know it is pretty dark and gloomy outside, so we are really appreciative for your time and for your attention. I do want to thank you all for being here, but I also want to thank our team for also being here today. Quick plug, we are celebrating Health Equity Week this week. So with all of the things going on, we are really excited that those who have taken the time to be with us today are here and have the opportunity to be here. So again, thank you for being with us and for your willingness to really engage with us in our conversation this morning. We do have some amazing people that we will get to know a little bit later today, which we are super excited to hear from. But before, we do just want to give you all a little bit background into who we are and why we show up in this space the way that we do. And so, as we mentioned, as mentioned, my name is Namandje. I use she, her pronouns, and I am the current program manager of training and outreach at Health Equity Solutions. I am very excited to be here with you all to collaboratively learn in space together and to really maybe add some sunshine, hopefully, to this disgusting and rainy day. So Health Equity Solutions, we are a nonprofit organization in Hartford whose vision is for every Connecticut resident to attain their optimal health, regardless of race, ethnicity, and or socioeconomic status. And we aim to do this by advancing health equity through a very specific anti-racist lens through anti-racist policies and practices. And so, as I mentioned before, we are celebrating Health Equity Week. So please do not hesitate to stay connected with us, to be informed regarding, all the things that we have going on this week. At the end or towards the end of our program, we will add our emails into the chat so that if anyone is interested, you know where to find us. All right. And so what is health equity? To understand health equity, right, we really need to understand that equity alone allows everyone to have the resources that they very specifically need, as opposed to resources blindly given or maybe generally situated in our community. And so on the slide, you will see two different definitions for health equity, which we really like to acknowledge because each definition really brings in different aspects of our understanding of what health equity means. And so health equity really means for everyone to have a fair and just opportunity to attain their optimal health, regardless of these social and or structural barriers, while also requiring the removal of the obstacles that then aid in these barriers from happening in our community. Awesome. And so expanding on that, right, thinking of social and structural determinants of health, these are the conditions that we are born into and we grow in as we age, right? These conditions are shaped by the distribution of money, power, resources. And as you can see on the graphic to the left, they're influenced by all of the things, right? All of the isms, all of the institutions that we navigate on a daily basis in order to really get us to that optimal health outcome that we all so deservingly deserve, right? Just based off of a human right. And so our healthcare outcomes are a direct result of these isms, really influenced by all of these social and structural factors in order for us to really show up as optimal as possible. In the same conversation, we do want to, really uplift our topic, right, and why we are really here this morning. And so now that we understand who we are as Health Equity Solutions, we understand what health equity means and how these factors really influence, our social climate today. We really want to uplift and, understand why we are here today. And so we have had the wonderful opportunity to partner with the Yale Housing and Health Equity Lab. And, while Dr. Keene is not available to be with us in the physical, she has recorded a video on behalf of her and her team to, be with us in some form. And so we are very, very, very thankful that she has taken the time out of her very busy schedule to still be with us. And so with that being said, we will play her presentation.
Welcome, everyone. Thank you to Health Equity Solutions for inviting me to this webinar. I'm sorry that a prior commitment prevented me from joining you live, but I hope we can have some follow-up conversations. My email is on the slide if you want to find me. My name is Danya. I'm an associate professor at the Yale School of Public Health, where I direct a research group called the Housing and Health Equity Lab. And I have the great pleasure of working with this amazing team of students and colleagues, including PhD student Whitney Denary, who is with you virtually today. Before you chat with Whitney, I'm just going to provide a little background on the intersections of housing and health and tell you a little bit about some projects that we're working on in our lab. So my interest in housing policy really began as part of a larger goal of advancing racial health equity. In the US, an ongoing history of racist policy has played a very large and unfortunate role in creating inequalities in wealth, health, and well-being for individuals and for communities. So housing is really an important place to focus our energy in the service of improving health equity. And over the years of doing this work, I've also come to recognize that not only is housing policy important for health justice, but public health data can be very useful for advancing housing justice. The COVID pandemic really got people thinking about how housing insecurity, evictions, and homelessness all contribute to poor health in our communities, and we can use these health arguments to clarify why housing is so important. And one of the reasons we focus on housing in our lab is that there is just a serious need for housing in this country. Rental housing has become increasingly out of reach. Just as one illustration, in 2021, the average worker needed to work 97 hours per week at minimum wage to affordably rent a 2-bedroom apartment. And one consequence of this affordable housing shortage is that households are just spending too much of their income on rent. In New Haven, where I live, you can see here on this graph that 50% of renting households are considered rent burden, meaning that they spend more than 30% of their income on rent. And these high housing costs are largely driven by low vacancy rates that allow landlords to drive up rents. And when the rent is high, tenants often have to settle for poor conditions. And when there's few affordable options, they're limited in their ability to advocate for quality housing. And we're hearing more about very poor conditions in our interviews with tenants in New Haven and Bridgeport and elsewhere around the state. And lack of affordable housing also leads to evictions. Tenants who are paying huge portions of their rent, of their income on housing, are only one unexpected expense away from falling behind and being at risk of eviction. And here in Connecticut, more than 20,000 households experienced eviction filings last year. And evictions are traumatic events that lead to a cascade of losses, including poor health outcomes. Evictions also are a major driver of homelessness, which is on the rise in Connecticut. So in summary, a lack of affordable housing causes multiple dimensions of housing insecurity that get under the skin to affect health. For example, if we're thinking about affordability, high housing costs can force renters to make difficult choices between their rent and other health needs, such as food or medication. And high costs can also force renters into units that have health hazards like pests, mold, lead paint, and other things. And all of these issues cause stress that is profoundly health harming and keeps renters up at night. And one of the things that we do in our lab is try to think about all of these dimensions of housing insecurity, because they're really interconnected and they all matter for health. We can't just fix one. We have to be thinking about the whole picture. Another thing that we are focused on in our lab is moving beyond the individual. So a lot of research on housing and health considers how someone's own housing or their lack of housing affects their own health. But in these papers on the right, we're really seeking to highlight that when one person loses their housing or doesn't have a place to live, the effects of this can reverberate across families, across networks, and across entire communities. We can't have healthy communities if some people do not have a place to live. For example, high eviction rates make it hard for people to organize to build healthy communities. And these evictions also strain resources. As another example, our team is doing some work on informal housing provision. We've been talking to people who provide housing to their friends, family, and acquaintances, sometimes at the expense of their own well-being and sometimes risking their own housing to do this, when taking a friend in can mean violating the terms of your lease. And these community impacts are highly unequal. An ongoing history of racially discriminatory housing policy, including redline, is responsible for vast inequalities in home ownership, in wealth, and housing vulnerability. It's also these policies are also responsible for pronounced economic and racial segregation that harm health. And the impacts of this discriminatory housing policy are compounded by other forms of structural racism, including the way the criminal legal system, mass incarceration, shape housing access. And this is something that we explored in a study that we just finished called the Justice, Housing, and Health Study. So as we evaluate the impacts of policies, we really need to pay explicit attention to racial equity. Who is benefiting from these policies? Do they mitigate or exacerbate underlying inequalities? And this is something that we're trying to do in our work. So speaking of our work, I just want to highlight 3 projects that we are working on right now. So the first project, called Project Reside, focuses on the current shortage of rental assistance or subsidized housing in this country. So rental assistance alleviates the rent burden that we talked about by adjusting a household's rent so they only pay 30% of their income. And this is done through vouchers or through project-based subsidies like public housing. But as you may know, there's a severe shortage of this assistance. As we can see in this graph here, fewer than 1 in 4 eligible households receives assistance, and often this is after very long waits on waiting lists. Nationally, there are 13 million eligible and unassisted households. And in New Haven, where I actually serve on our Housing Authority's Board of Commissioners, there are more than 30,000 households on these waiting lists. So the question that we're asking is, how does this current shortage of assistance affect health? And on the flip side, how could we improve health by expanding access to these subsidies? And we're answering these questions with a focus on type 2 diabetes. We've done other projects that have looked at other health outcomes, but for this project, we're focusing on diabetes. And one of the things that we've done in this project is to link national health surveys to HUD records and compare households who are receiving assistance to households who are essentially waiting for assistance. And in the paper shown here on the right, we found that receiving rental assistance was associated with reduced odds of uncontrolled diabetes. And these results really suggest that expanding access to these rental assistance may be able to improve the trajectory of a common and very costly chronic illness. So in addition to these national data, we're also conducting a longitudinal survey and qualitative interviews with a group of Connecticut residents who have diabetes and were on waiting lists for rental assistance back in April 2020 when the study began. Unfortunately, many of these individuals have since gone on to receive housing to get off the waiting list. And we've seen how this can improve, for many of them, can improve their diabetes. And in our interviews, we also hear from participants about some of the reasons that housing is so important for diabetes management. So our participants talk about the ability to cook their own food, the ability to maintain sleep schedules that are so important for health, to store their medications and develop a consistent routine, to be able to afford their healthy food and other diabetes-related expenses, and also the ability to work reasonable hours, not these 12 to 16-hour days that Jamie is talking about here, that people are having to work in order to just pay the rent. So that was Project Reside. The next project I want to talk about is our work on tenant right to counsel. Tenant right to counsel policies provide tenants who are facing eviction with access to a free lawyer. And in March of 2020, only 5 cities had right to counsel policies in place. But by July of 2023, 17 cities, 4 states, and 1 county had adopted right to counsel. So these are relatively new policies that are on the upswing. There are dozens more jurisdictions are considering right to counsel policies or have policies that are in the works. And in 2021, Connecticut was among the first 3 states to pass right to counsel legislation. And our team worked with the Connecticut Bar Foundation to complete a qualitative evaluation of right to counsel's first year in Connecticut. We conducted interviews and focus groups with more than 100 stakeholders, including many tenants, as well as lawyers, activists, landlords, and others. And we also recently launched a national study of right to counsel, where we're talking to stakeholders around the country and comparing differences in these policies and their impacts. So in this work on right to counsel, we see multiple ways that right to counsel can support health of individual clients and communities. The most important way is by helping to prevent evictions and all of the severe health consequences that are associated with eviction. But beyond preventing evictions, our interview data also suggests ways that right to counsel can support tenant health even when eviction is unfortunately unavoidable. For example, we see that when tenants experience less stress when they have a lawyer on their side. We also see how lawyers can help mitigate the harms of a forced move. For example, by helping a tenant secure extra time or resources to secure new housing. We also had questions about whether right to counsel could help address health inequalities by building tenant power to advance systemic changes in the service of housing and health justice. And both in Connecticut and nationally, we do see a lot of potential for right to counsel to support tenant organizing. And perhaps in this sense, the greatest health benefits of right to counsel will be from its ability to catalyze or support movements that really address the root causes of housing insecurity. And I also included on the slide for anyone who's watching this presentation and may be experiencing eviction or know someone who's experiencing eviction and may be eligible for right to counsel. This is the website, and there's a number there that you can call. So lastly, before I close, I just want to highlight one student project led by our lab's soon to graduate PhD student, Shannon Whitaker. So Shannon has focused her work over the last few years on gentrification and its impact on the health of Black communities. And she frames gentrification as part of a process of serial displacement that has affected Black urban communities across generations, including here in New Haven. And she recently conducted a concept mapping exercise with New Haven residents to understand the impacts and experiences with gentrification in this city, and also to collectively imagine a different path forward. So one of the things that Shannon's work highlights is the need to move beyond housing policies like rental assistance, for example, that just mitigate the harms associated with our current system. If we really want to advance both housing and health justice, we need to think about more transformative changes. For example, how do we address these huge inequalities in homeownership? Or how do we create different models of housing that move beyond the current for-profit system and maybe better able to support health in our communities? So Shannon's concept mapping project also raised the need for reparations to address the health harms that were caused by this long history of racist housing policies, as described here in this Atlantic article that was published in 2014, so exactly 10 years ago. So thank you for listening. I'm really sorry that I'm not there with you to have a conversation in person, but here is my email. And I just want to thank all of the people on this slide and funders for supporting our work. And I hope you have a wonderful rest of the webinar. Take care.
Awesome, awesome, awesome. She is a force, and we are very thankful that she took the time to put that together. With that being said, I will pass it to my teammate, Taylor, so that we can get into the rest of our content for this morning. Thank you.
Awesome. Thanks, Namandje. And thanks y'all for being here. Right, Dr. Keene shared so much like valuable, incredible information. The lab is doing incredible work, but also you have to acknowledge that I don't know if she shared anything that any of us may have not known. Right, we know that housing is increasingly unaffordable, inaccessible, and unsafe, specifically for our Black and Brown communities. And many of us either have experienced it ourselves, our loved ones, or the communities that we love and care and are a part of are also experiencing this. Right, and she drew this really critical tie between housing beyond just the physical safety of being sheltered, right, but the effects it has on our mental health, on our physical well-being, and on that community connection and social connection that we all need to thrive and to build our health equity and to build to our optimal health. And so with all that, right, I'm thrilled to be in this space with you all, everyone who's shown up today to take this hour with us. Happy to be in space with you all, and I'm thrilled to be in a space with these panelists that we have. And we've got an hour, so we're going to go a little bit quick. We're going to move. So I'm not going to read everyone's bios. I will tell you that they are incredible. If you have a chance, please read them. We want to uplift the folks here, but we're going to get to the questions. I know many of you probably have questions and want to engage in this conversation, and we're thrilled to be here, right? So real quick, just to give you all, my name is Taylor Tucker. I use he, him pronouns. I am the Director of Training and Outreach here at Health Equity Solutions. We have Whitney Denari. Did I pronounce your last name correct, Whitney? Amazing. Okay. Who is a PhD candidate at the Yale School of Public Health, and she is in Dr. Keene's lab. So we're really excited to have her. We have Latoya Tyson, who is our training and outreach specialist here at Health Equity Solutions, and Callie Moquette, who is our senior manager of policy and advocacy at Health Equity Solutions. So we're going to jump right in. And as mentioned from Danielle earlier, please feel free to drop your questions in the chat. We are going to do our very, very best to get to it. We have a packed panel. If anyone's ever been to a panel, right, there's never enough time to engage with folks. It's just there's infinitely, we wish there was more time. So we're going to try to pull up some time at the end to grab questions. And we're also going to ask our panelists if they can consent to sharing their emails in the chat so people can follow up. I know Danielle is going to save the chat. So if there's any questions that we missed that any of us can follow up on or share resources in any way, please know that we are not ignoring you. And that we care about all the things that you have to ask, and we're hoping that we can support that. So with that, real quick, I have a question to everyone. How does housing instability contribute to health disparities, specifically among marginalized communities? So again, I'm going to ask whoever wants to jump in, feel free to jump in on that question to start. And, panelists, feel free to come off mute. We can have a conversation to the best of our ability. Zoom's a little wonky sometimes, right? But we're going to do it and we're going to move through it. And so this question is for everyone, right? Again, how does housing instability contribute to health disparities, right? Specifically among our marginalized communities?
So I can start. Good morning, everyone. Thank you for joining us. As we all heard Dr. Keene mention, housing instability can lead to a multitude of health issues, right? We have to deal with the issues around stress, uncertainty, instability, and imposes. We know that specifically if you are in unstable housing, you lack access to proper nutrition, you are having an inadequate diet, you have limited access to nutritious foods, they're costly, you have to prioritize basically figuring out where you're going to sleep at night, whether you're going to eat. We also know access to healthcare is a significant barrier. If you have financial constraints and you know that going to a doctor's office or getting seen in an emergency room is going to exacerbate additional debt and create additional barriers that you have. We also know that it leads to other social determinants of health, such as poverty, racism, discrimination, lack of educational opportunities. And so having all of those interrelated, it impacts your mental health, like you mentioned, Taylor, and it just leads to a whole host and other array of issues.
Yeah, absolutely. Callie, thank you.
I'd like to add a small point to all of that because Callie was really good in giving the broad picture there. But some of the small details, just like medications, for example, when people are unhoused, we don't necessarily consider that there are times where people have medications that need to be refrigerated, that they can only take, as Callie mentioned with nutrition, they can only take with food versus without. And they seem like very minor things, but they have an extremely huge impact on when folks do not have those things available, whether or not they're even going to be able to take their medications versus not.
Absolutely, Toya. Thank you so much for bringing that up, right? And the importance of our thinking about health, right? Health is all inclusive. Health is all things, right? And also the access to have the medication that you're prescribed and what that means for your health. And so thank you so much for bringing up that really, really important point. Whitney, I want to call and see if there's anything else that you wanted to add.
Yeah, I think Latoya's point is really important, and aspects of like not just having a house, but having a house that can meet your needs. We meet with a lot of folks who don't necessarily have like refrigeration or a stove or a place to actually serve their food and cook in a kitchen. And so while they may be housed, that doesn't mean that their quality of housing is meeting those needs. And so there's a really interesting spectrum of what housing can mean to meet everything that you really need to be healthy.
Absolutely. And Whitney, actually, I'm going to have you stay off mute because I think the next question is going to you. And I really love that pull you're having this conversation, right, around housing is more than just shelter, right? It's more than just a space. And I think that Danielle really pointed out about PSC and the work that you all do is this idea around like the choice of housing that meets your needs, right? And we think about that at Health Equity Solutions around what optimal health means for the individual, because my health is going to look very different than Latoya's, right? Just like the things that we need as human beings are on a spectrum. And Whitney, I love that you are plugging this, and everyone's kind of plugging this into this space. So Whitney, for you really specifically, how do discriminatory housing policies and practices contribute to health inequities, and what steps can be taken to dismantle those barriers?
Yeah, so as we've been talking about, without consistent access to housing, people have limited access to the routines and resources that actually promote health. And so they may think, oh, I need to do this, but they might not actually have the access to within their community. And the structural racism that has been pushed into like historical and ongoing like racist housing and policies and practices have developed inequities in homeownership, wealth, housing vulnerability, such as like segregation and urban renewal, zoning laws that we see still today, in addition to the history of redlining that has really separated our communities from the tools that they need that actually promote the health. So thinking about having a health clinic close by that you can go to without having to take a bus that'll take an hour or two and really disrupt your day. And so by performing like research or pushing the policies that we're talking about here that work against those racist formworks. And we can think about like how our current mitigation might be helping, how those policies that are already in place might be helping, but also how they might not be actually meeting what we need. And so in order to actually be able to address it, we need to have a strong knowledge of what the history is, and a strong connection to the communities to understand what they're saying they need in their health. And how we can actually have our community organizations, in addition to our policies, to push those resources more.
Awesome. Thanks, Whitney. And real quick, are you seeing anything like what kind of discriminatory practices are you seeing? Like, are there insidious things, right, that things people may not know about that are existing that we can just let people ensure that they have the knowledge around?
Yeah, it's hard for me to say if people don't know about it, because I feel like, as you said earlier, these are all things that we already talk about. These are things that we know in these spaces. And I'm not sure that like maybe policymakers know about them because they aren't living the day-to-day that we are. But one thing that really strikes me as far as eviction is once you get an eviction on your record, it's so much harder to get a landlord to rent to you. And so then you're really slotted into these specific areas that you can live in, or this specific housing. And so your opportunity is just so much less. And so that also drives aspects of forced moves. So instead of getting an eviction, you might just choose to leave as soon as you get that notice, or as soon as you think you're going to fall behind on rent. And so that can contribute to things like doubling up, living with family members, not having enough room to really live, or having the autonomy to meet your health needs. And yeah, all of those policies kind of just cycle into each other.
Yeah, no, absolutely. And I appreciate you bringing up that eviction, right? Because we don't know if it's just like, some people are like, oh, if you have an eviction, you can still rent, right? But that makes it harder. And so just knowing that even, right? And like, and also knowing that sometimes you can't, it doesn't matter because you can't change it, right? But those thinking about how discriminatory practices kind of roll into each other, like you said, become a snowball effect for folks. You know, and Callie brought up medical debt. We talked about medication, right? All of these things are not siloed and they're not singular in the way that we intersect with the world. So Latoya, this is a question that's a little bit focused for you. Affordable housing often intersects, right, as everyone has said, as Whitney really shared, other social determinants of health, right? We talked about access to healthcare, education, medical needs. How can a holistic approach to addressing these intersection issues lead to better health outcomes for communities and individuals?
So I'm just going to reiterate in what you've just stated. All of these things circle each other and they overlap each other and they intersect with each other all the time. And I would like to challenge the term determinant, right? Because when we use that term, that kind of makes it a set thing. Like it can't be changed, it can't be undone, it can't be something different. I would like to use the word influencer, right? Because the social influencers of health are things that can actually be changed. They have been strategically and systemically, as Whitney has mentioned, been put into place to work in a very specific way without taking into consideration that every single person that is alive is a complex multitude of layers, right? We're like onions and you have to peel back all of these different components. And you cannot expect health and the ideal health for any individual if the environment in which they are in is not conducive to supporting their entire health. Being able to address other components to the physical health includes addressing mental health. If you are someone who lives in an area where there is low employment rates, for example. So we're talking about housing not necessarily being affordable. If you can't afford where you live, you can't afford going to the doctor. So you're going to have to make a choice, right? If you can't afford that, then you cannot necessarily afford medications that you may need to be on for physical ailments. If there is not any money being invested into your community to ensure that there's transportation, as Whitney mentioned earlier, if you have to take several hours off of work just to get to an appointment that you need, then and yet there is low income in your area, it all goes into this one big circle. It's this huge melting pot of systemic issues that we can and should be working toward changing.
Latoya, I hope you saw a lot of people reacting to that statement, right? And I really want to uplift and like just hold at our center, if I could have what I call like a Vegas show light, right? That highlights what you shared, right? But specifically this piece around that this can be changed, right? Structural issues, they're not naturally occurring. They didn't just like happen overnight. They didn't just naturally happen, right? They have been put in place, right, by historical systems, by oppression systems, by people at the end of the day, right? They have been put in structure by people, right? But there are people here in this space who are also working to dismantle it, right? Many of us here because we care and we want to dismantle them, right? So I think that's a really important message in this work, is that they're not determined. They don't have to determine your move, right? They are highly influential in the way that you access things because they have been built to be influential, but they can be moved, right? Especially if we move them together, right? In community. And I think Dr. Keene really brought that up too, is thinking about, we have to think outside the individual, right? Like the impact and the ripple effect. I know we talk about this a lot at Health Equity Solutions, right? The ripple effect of what it means when an individual is not cared for is actually a community-wide effect, right? It's your church, it's your Boy Scouts, it's your kid soccer team. Everyone is affected by one person, right? Being marginalized or being hurt in some system. So I really appreciate you bringing that to our forefront in this conversation today and reiterating that. Callie, so I have a little bit of a focused question for you. So as a policy advocate, right, what specific legislation or policy changes are really necessary to address the systemic issues contributing to housing insecurity and health disparities?
Thank you for that great question, Taylor. I definitely have lots of ideas, right? We know that we have some laws and policies that exist, but as LaToya and Taylor just mentioned, they're structurally implemented. So in order to remove them from our system, we need to reshape the laws and the way we view providing additional resources. So we have some fair housing laws, but we need to ensure that we're strengthening the enforcement of those laws to prevent discrimination in housing practices based on race or ethnicity, gender, disability, and other protected characteristics and classes. We need to expand healthcare access and services. We need to include health and substance abuse treatment for individuals experiencing housing insecurity. We need to ensure that we're doing Medicaid expansion and expanding our community health centers. We also need to focus on our urban planning and development. Let's make sure that our principles of urban planning are equitable. Let's make sure we continue to implement mixed income-based housing developments. Let's strengthen Connecticut's transportation infrastructure. As we've all spoken about, our transportation structural system is not equitable. It's not working for those who need it the most. Those who it works for the most are likely those who have vehicles and can get there on their own. Let's ensure that we are implementing community land trusts so that those who live in those areas are able to benefit from the land that's around them, right? We need to make sure that we're having sustainable and inclusive neighborhoods. We end up having a lot of developments that come in and they start with affordable housing, and then all of a sudden they're being yanked out and they're being sent elsewhere, like that gentrification we were talking about. Let's ensure that we're expanding our ability to protect our homeless population. Let's expand our programs. Let's invest in homelessness prevention programs. Let's have more rental assistance programs. Let's have rapid rehousing initiatives. As you heard everyone mention, the waiting lists are thousands of individuals long. We need to figure out a way to get that to work, sitting down and matching minds. We also need to make sure that when we are having our tenants facing eviction, that we enhance our tenant protections. Connecticut is one of the states that does offer now legal assistance, but there's a lot of other things that lead up to that eviction that are all self-help, right? There's credit collections and debt collections that all lead to you being unable to pay your rent to begin with. So we need to make sure that we're supporting these things. We need to also, although it's not a complete fix, let's expand affordable housing. We need to have way more housing that aren't just 1 and 2 bedrooms. That's not reflective of the families we have in Connecticut. We need additional affordable 3-bedroom units, 4-bedroom units, and that we're allowing that where the majority of our most impacted residents reside, that housing is right there where they need it, where they work. And we need to make sure that regardless of anything, let's give some child tax credits. Our families need additional options for financial reprieve. Connecticut is one of the most expensive states to live in. And we know that our residents are they're inundated with a whole host of medical debt. This is just a prevalent conversation, and just thank you for this question again. If we can implement some of these policy changes, I know for a fact we can dismantle the systemic barriers contributing to housing insecurity and health disparities. I know it in my heart.
Callie, I love this. And I want to pause real quick, y'all. So I have 2 questions left. I'm actually going to shift them to be everyone questions, because I think this next question really leads into this. But I love what you said, right? And again, this is just a beautiful, like, kind of transcendent conversation that everyone's weaving into each other right from the beginning, which is just really such a beautiful thing to witness as we're talking about all the different ways that change happens, right? It's because we're all thinking about it from the same but different perspectives, right? Because you have to look at it in so many, like a holistic way, right? An all around way. And I really love, Callie, what you're talking about is both kind of this connection to like dismantling systemic roots, right? Pulling the roots out of the system and also giving people help where they need it, right? You can't just do root work because people are suffering right now because the system has been living and breathing for so long, right? Like we actually need to get money into the hands of people. We need to have affordable housing that is their choice housing, that's safe housing, that's accessible housing. And we also need to dismantle the systems, right? Both of those things have to happen, right? And it reminds me of a classic social work proverb, right? People are drowning, people need to get people out, and also fix why people are drowning. Both of those things have to happen at the same time, and we can't talk about them in silos, right? They can actually happen within together and in partnership together. So I just love this so much. So I'm actually going to open this up to an everyone conversation because Whitney, you actually touched on this a little bit earlier. So I'd love to bring you in. So it was originally a Callie Latoya question, but I'm going to bring you in because you touched on it. So now you're joining the group for this one. So again, I have two last questions. So I have this one and then a last 30-second question because there's some good things in the chat that I want to try to get our very best to as we're running out of time very quickly. So for everyone, how can we ensure that the voices and experiences of those directly affected by housing insecurity and health disparities are centered in our policy discussions and decision-making processes? And so Whitney, I'm going to give this one to you first. You touched on it a little bit and some of the, and Dr. Keene touched on the research. So I would love to hear your perspective on this one before I pass it over to some of my teammates.
Yeah, one thing that we really focus on in our lab is doing qualitative research with people who are in the community. And so that involves sitting down and having conversations, either in big groups or typically one-on-one, to really get at the nuance of how housing is impacting people's health. And these conversations have illuminated the daily lives and we've been able to then put them in publications, put them in our letters to governors and legislators, to be able to say these are the real life experiences that are happening on the ground. And a lot of folks are, they're living it. They have really smart ideas on how to fix these policies. And so using those voices in a way that everybody can kind of access. It's not just Connecticut specific. It's not just New Haven specific. We can spread this throughout the nation to be able to say, these are things that can help. I think that's really important.
Awesome. Thanks, Whitney. Before I comment, I want to pull in my two teammates, Latoya and Callie, and what your thoughts are.
So similarly to what Whitney just said, at Health Equity Solutions, we create legislative priorities every year, but we don't create them in silos. We intentionally hold community conversations where we hear from the community specifically what the issues and barriers are that are prevalent to them. And we use that to form our policy agenda. We've started this since 2020. Since to date, we've had about 570 responses from individual residents from across 47 towns, right? So we need to continue to ensure that we are pulling in our community voices, that we don't work in silos. We need to ensure that we're expanding language access too, right? To make sure that if we have these resources and we want to collectively receive these experiences, that we're doing it in a way that can be reached and understood by those who need it most. And so, this is Health Equity Week, right? And it's a week recognized in Connecticut state statute where Connecticut is supposed to be committed to addressing issues and barriers affecting our residents from achieving optimal health. So let's make sure that we're listening to our residents.
Amazing.
And the only thing that I'm going to add to that is that as we are in the process of receiving information from residents, that we still keep everything in their voice, because sometimes what ends up happening is folks come into certain communities, they are asking for input, they're asking for conversation, they're asking to find out what the community needs, but the way they receive the information from their own viewpoint, they modify what is actually being told to them. So being very careful to be cognizant that the information that we're getting, that when we are distilling all of that, that it still comes through the voices of the people that are directly impacted.
Oof, y'all are dropping so much truth right now. I see it happen in the chat. I see people reacting to y'all. So thank you. And I want to really just tie what you all said, right? Is when you talked about this access, right? And sure, I'm seeing it in the chat. You're being able to drop your research to folks. You're saying, if there's a paywall, let us know. We'll get you the article, right? That's important. You can't do the research in the community and then not have the community have access to it. It's right. It's kind of what Latoya is talking about, right? It's not in their voice. It no longer belongs to them, right? You go in, you come out. We're thinking a lot about what it means to build policy, right, from the space of people being most impacted, right? And I think a lot about my mentor, his name is Roosevelt Smith. He always talks about the wisdom is in the room, right? Which means like people closest to the problem know the solution, right? And communities have been doing it for years. Like we can't not remember that communities, specifically Black and Brown communities, communities of color, right? LGBTQ communities, right? All these different communities who have been historically marginalized by the system have always been innovative, have always been caring for themselves, right? So if we look to them to solve their own problems and build policy, right, that's reflective of those communities, it's only going to be better, and ensuring that people have access to how they do that. And so I love this. And then our final question, real quick, I'm going to give everyone like 30 seconds maximum. I am going to time you. What is one thing that you hope folks leave with from today's conversation? That's for all three of our panelists before we get to any questions in the chat.
I can start. And so thank you again, Taylor. I think one thing that I would like everyone to walk away with is knowing that we hear you, we hold that your experiences have been true, and that there are ways that we can get involved to ensure that we continue to amplify the solutions that you all need, right? Reaching out to your legislators, reaching out to any of the organizations present today so that we can continue to push this fight and support you in this journey. Your experiences have not been unique, and that is not something that we should be able to say, right? We know that these issues to housing are impacting so many areas of your life. We specifically want to help highlight and support you. So I hope that from today you feel heard, that you understand that we are thinking through solutions, that we do not think it's up to the policymakers alone, that together we can absolutely dismantle a lot of these systems that are working exactly as they are designed to work. They're not broken, right? They were created this way on purpose. So let's ensure that we work together as a community, because the solutions and to all of these issues lie within us. No one's coming to save us. We are here to work with you and work for you. And so I would love all of you to have that and know that.
Awesome. Thanks, Callie.
Good morning. My name is
Hi.
Aurora. How I can get that information for ask for all these programs?
Yeah, Aurora, if you give me 1 second, I'm just gonna, 1 quick second. I think if you have a question, I'd be happy to hold it till the last second. I just want to engage our last two panelists in the final question, but I want to make sure that you get the resources that you are asking and that we can make sure that we can address your question. If you just give me 1 quick moment. But it's nice to see you this morning, and I hope you're having a wonderful day. All right, so LaToya and Whitney, last question again. Like, what is one thing you hope folks can leave with after today's conversation?
I'll go if you don't mind, Whitney. I really want to piggyback. At the end of the day, the people are the ones in charge. And I think we forget that, because we have these people called, legislators and senators, and we have all of these people with these titles doing all this great stuff. And in some cases, it's not such great stuff because it doesn't actually benefit us. But we, the people, have the ability to put them in position to do what we need them to do. And so I want it to be just remembered that we have the power, and we as the people need to exert our power when it comes to working with these folks in our legislation. We need to let them know if they're not doing the jobs that we need them to do, that we're not going to sit idly by and just watch them just be there and handling what they want to handle in the way they want to handle that does not benefit us as a people. And I just want people to understand that we have power. We have way much more power than we have been led to believe, and that we sometimes believe in ourselves, but we do have the power.
Thanks, LaToya. Whitney, you're here to wrap us up a little bit.
Totally. Building on that, I think that something that's really resounding for me from this conversation is how mainstream these conversations are, how universal these experiences are. And part of that is because of so much community organizing. We all kind of have heard this in our family conversations at the dinner table, in these larger conversations on Zoom. And so continuing to push that conversation, even when it might feel like, oh, I'm just doing this and it's not going to make an impact, those small moments will make an impact and lead to larger moments that push change.
Awesome. Thanks, y'all. And I think you all brought up that really clear point that right? Sometimes when legislators are making that, often when legislators are making policy or people are making policy, they're looking at the numbers, right? They're looking at the bottom line, they're looking at this, right? But what the qualitative, what these stories and what community organizing and what these conversations mean is that those numbers become just numbers, but when we tell our stories, they become stories, right? They become people, they become communities, right? They become a common thread versus just looking at numbers. And so I'm so thankful that y'all were able to be here and be on this space. And I want to pull in a couple questions. We got 4 minutes, so I'm going to do as many questions as we can possible. So the first question here that I see from Sarah is there an inclusive focus on mental health and disability in the research? So Whitney, I think that's geared more towards you in your lab.
Yeah, happy to. So much of our research right now is focused on diabetes because we have this long 5-year grant that's really focusing on how housing impacts diabetes. And with that, diabetes in and of itself is often considered a disability. A lot of our participants are attempting to get disability benefits, although that can be a really long process. And so in that aspect, certainly. And then we also are connected to so many other researchers across the nation who are focusing more on different aspects of disability. And mental health is something that is resounding across the board in this research because housing is first and foremost something that impacts first just your day-to-day weathering, your day-to-day ability to go on. And if you don't have all of your needs met, you're going to get down about it, so to speak. And while we're able to just kind of colloquially say like, oh, it makes me sad, etc., those are real conditions that contribute to your physical health, your mental health. And so most of our research has a focus of mental health with that. We've also found that policies like rental assistance do actually improve like psychological distress, anxiety, depression. And so we're making sure to focus in on that because there really is such a strong connection between our physical health and our mental health. And without a strength in one, you're going to have a default in the other.
Thanks so much, Whitney. Does anyone else want to come off mute or have a question in the chat they want to get to? We've got 2 minutes left. And I want to ensure that we're using those 2 minutes because I know this was a really robust and really beautiful conversation. So if anyone has any last minute question, wants to drop something in the chat, please feel free. And as folks are doing that, I also want to acknowledge Tanya. Did I say your name correctly?
Oh, sorry. Hi, it's Tanya. And I just wanted
Tanya.
to touch on real quick, that like the energy burden too, with the bills. I know they talked about it before, but we're campaigning for like, an energy narrative so folks can tell their stories of the unaffordability with utilities, and like trying to put a hold and some control over what Eversource is doing.
Awesome. Thank you for uplifting that. And if there's any information about it you want to drop in the chat, please feel free to. I know many people here would probably be really interested in that work. So thank you so much for highlighting that. I'm also going to ask all of our panelists right now to drop their emails in the chat. For those who didn't, I know I didn't yet, but for anyone to please drop your emails in the chat. And please, if there's any resources that people want to gather, feel free to connect with each other. Feel free to share resources, right? This is always a space that if we can uplift as many resources as folks have and we can share them and we can be organizing together, right? That's hopefully what this space is for. But it is 11, and I just want to give a huge thank you to Partnership for Strong Communities for inviting us into this space. Whitney and the Yale School of Public Health and the Housing Health Equity Lab. Jesus Louise, the whole time I had my words straight except here, but we appreciate you and are so thankful for your generosity to show up in this space. Please give our love and care to Dr. Keene and thank you and gratitude. And I'm sure that you will not be the last time you hear from us and in all the folks in this work. So we're so thankful for you showing up. HES, my team, thanks y'all. You are all rock stars all the time. And thank you all for participating and being in this space with us. We are so grateful and we hope you have a wonderful rest of your day. If you have any interest Health Equity Week, we're doing it this week. Get on our website. Harley dropped it in. We hope to see you on Thursday in person. There's going to be a great panel. There's going to be an event, an award. There's so much going on. We hope to see you all in person, engage with us, and wishing you all a wonderful rest of your day.
Thank you all so much. I did drop in the chat just for folks who want to grab it before you jump off. Our next webinar session will be May 1st. It's going to focus on affordable housing and food insecurity. We'll be working with the Connecticut Food Bank. So great conversation to continue off of what we learned here today. But thank you guys so much. We appreciate all the work you're doing and all of the great conversations you brought here to folks today. I hope this leads to a lot of great connections for folks. And it is 11:01, so I will release you all back to the rest of your days. But thank you, everybody, and looking forward to being in touch in the future.